Hey everyone, and welcome back to the channel. Today we're diving into a topic that's incredibly important for men's health, yet often flies under the radar until problems arise. I'm talking about the prostate. By the time most men hit their mid-40s and sometimes even earlier, the prostate can start to signal that it needs a bit more attention. These signs might creep up slowly, almost imperceptibly, or they might manifest more noticeably. But the key is understanding that changes are common and, more importantly, manageable if you're informed. Whether we're discussing something like benign prostatic hyperplasia, often called BPH, which is a non-cancerous enlargement of the prostate, or the more serious concern of prostate cancer, knowledge is your most powerful ally. Knowing the early warning signs, understanding the risk factors, and being proactive about prevention strategies can genuinely be a lifesaver. It's not just about adding years to your life, but life to your years, ensuring you stay active, comfortable, and healthy. Many men feel a bit hesitant to discuss these issues, but opening up the conversation is the first step towards better health. So, in today's video, we're going to break it all down. We'll explore what your prostate actually does, what common issues can affect it, and most importantly, what you can do, leveraging natural approaches and lifestyle changes to support its health and keep yourself feeling strong and vital for the long haul. We're going to empower you with information so you can take control. Let's get into it. So, what exactly is this prostate gland we're talking about? Well, picture a walnut. That's roughly the size of a healthy prostate in a younger man. It's a small but mighty gland that's a crucial part of the male reproductive system. Its primary job is to produce seminal fluid, the milky liquid that nourishes and transports sperm. This fluid makes up a significant portion of semen, so without a healthy prostate, fertility can definitely be impacted. It's one of those organs that works quietly in the background, but its contribution is absolutely essential for reproductive function. Now, let's talk about location, because this is key to understanding why prostate problems can cause such specific symptoms. The prostate is strategically situated just below the bladder, and it actually wraps around the urethra. The urethra, as you know, is the tube that carries urine from your bladder out of your body, and it also carries semen during ejaculation. Because of this close anatomical relationship, when the prostate gland starts to enlarge, for whatever reason, it can begin to squeeze or press on the urethra. This is like a kink in a garden hose. It restricts the flow. This pressure on the urethra is the primary reason why an enlarged prostate, whether due to BPH or, in some cases, cancer, leads to those telltale urinary symptoms that many men experience. Think about it. If that tube is constricted, it's going to be harder for urine to pass through smoothly. This can lead to a weak stream, difficulty starting urination, or feeling like your bladder isn't completely empty. Understanding this anatomy helps to connect the dots between the prostate's condition and the symptoms you might notice. So, while it might be small, the prostate's health has a ripple effect on urinary function and overall quality of life, especially as men age. It's not just about reproduction, it's about comfortable day-to-day living. That's why paying attention to this gland, understanding its role, and knowing what can go wrong is so fundamentally important for every man. We need to shift the mindset from reactive care to proactive awareness and maintenance of prostate health. As men age, particularly after hitting 40 or 50, certain prostate-related issues become much more common. There are two main conditions that we primarily focus on when discussing prostate health in this age group. The first is benign prostatic hyperplasia, or BPH. The key word here is benign, meaning it's not cancerous. BPH is essentially an enlargement of the prostate gland. It's incredibly common. In fact, it's estimated that about half of all men between the ages of 51 and 60 have BPH, and that number jumps to as high as 90% for men over 80. While it's not life-threatening in itself, BPH can significantly impact your quality of life due to the uncomfortable urinary symptoms it causes. The second major concern, and one that understandably causes more anxiety, is prostate cancer. This is the second most common cancer diagnosed in men globally, trailing only skin cancer in some populations. Unlike BPH, prostate cancer involves the malignant growth of cells within the prostate gland, which can potentially spread to other parts of the body if not detected and treated early. The good news is that many prostate cancers are slow-growing, and with early detection, treatment outcomes are often very positive. This underscores why awareness and screening are so vital. So, what are the alarm bells you should be listening for? The symptoms for both BPH and early-stage prostate cancer can actually be quite similar, which is why it's crucial not to self-diagnose. These include urinating more frequently, especially waking up multiple times during the night, a condition we call nocturia. You might also notice a weak or interrupted urine stream, a feeling that your bladder isn't emptying completely, or difficulty starting or stopping urination. Some men experience dribbling at the end of urination or an urgent need to urinate. Beyond these urinary changes, other symptoms can sometimes arise, although they may be less common in the early stages or more indicative of advanced issues. These can include pain or a burning sensation during urination, blood in the urine or semen, hematuria or hematospermia, pain in the back, hips or pelvis that doesn't go away, or painful ejaculation. It's important to remember that experiencing one or more of these symptoms doesn't automatically mean you have a serious problem, but it absolutely means it's time to have a conversation with your doctor to get things checked out properly. Your proactive plan. Natural strategies for prostate protection. Alright, let's shift gears and talk about what you can actively do to support your prostate health and potentially reduce your risk of developing problems. The great news is that many of these strategies are natural and involve smart lifestyle choices that benefit your overall well-being, not just your prostate. First up is nutrition. What you eat plays a massive role. Focus on incorporating more cruciferous vegetables into your diet. I'm talking about powerhouses like broccoli, cauliflower, kale, Brussels sprouts, and bok choy. These veggies are rich in compounds like sulforaphane, which has shown anti-cancer properties and can support detoxification pathways. Think vibrant, colorful plates. Beyond cruciferous veggies, certain nutrients are particularly beneficial for prostate health. Zinc is a key mineral found in high concentrations in the prostate, and maintaining adequate levels is important. Excellent food sources of zinc include pumpkin seeds, a fantastic snack, as well as legumes, nuts, and shellfish. Another important mineral is selenium, an antioxidant that helps protect cells from damage. Brazil nuts are an incredibly rich source of selenium. Just 1 or 2 a day can often meet your daily needs. On the flip side, try to reduce your intake of red meat, especially processed meats, and highly processed foods in general, as some studies suggest a link between high consumption and increased prostate cancer risk. Next on our list is regular physical activity. Exercise is a cornerstone of good health, and your prostate is no exception. Engaging in regular exercise helps to reduce overall inflammation in the body, which is a known contributor to many chronic diseases, including prostate issues. It also supports healthy hormonal balance, which can be crucial for prostate health and helps with weight management. Being overweight or obese is a risk factor for more aggressive forms of prostate cancer, so maintaining a healthy weight through diet and exercise is a double win. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, plus some strength training. Finally, let's not underestimate the impact of stress and the importance of screening. Chronic stress can wreak havoc on your immune system and disrupt hormone levels, potentially contributing to conditions like prostate enlargement or exacerbating existing symptoms. Incorporate stress management techniques into your routine, whether it's meditation, yoga, deep breathing exercises, spending time in nature, or engaging in hobbies you enjoy. And crucially, talk to your doctor about prostate cancer screening. This usually involves a PSA, prostate-specific antigen blood test, and sometimes a digital rectal exam, DRE. The age to start screening varies based on individual risk factors, including family history, so a personalized discussion with your healthcare provider is essential to make an informed decision. Knowing when to act, don't delay. Seeing your doctor. Now this is a really important point. If you start experiencing any of the symptoms we've discussed, changes in urination, pelvic discomfort, anything that feels off, please don't wait it out, hoping it will just go away on its own. While it's easy to dismiss early signs or attribute them to just getting older, early detection is absolutely everything when it comes to managing prostate health effectively. This is especially true for prostate cancer, which is often highly treatable, with excellent long-term outcomes, if it's caught in its early stages before it has a chance to spread. Ignoring symptoms can unfortunately lead to delayed diagnosis and potentially more complex treatment down the line. The power of early detection cannot be overstated. When prostate cancer is identified while still confined to the prostate gland, there are numerous treatment options available, many of which are less invasive and have fewer side effects than treatments for more advanced disease. This could mean the difference between a relatively straightforward procedure or radiation therapy and more aggressive systemic treatments. So, viewing a visit to the doctor not as a cause for alarm, but as a proactive step towards safeguarding your health, is a crucial mindset shift. Think of it as an investment in your future well-being. Even if you feel perfectly fine and aren't experiencing any overt symptoms, scheduling regular checkups with your doctor is a smart move, particularly as you enter your 40s and 50s or earlier if you have specific risk factors like a strong family history of prostate cancer. Your doctor can assess your individual risk profile, discuss appropriate screening timelines, and answer any questions you might have. These regular visits create a baseline for your health, making it easier to spot any significant changes over time. Remember, prostate problems don't always announce themselves with loud, obvious symptoms. Sometimes, as we've mentioned, the signs can be subtle, like a whisper rather than a shout. It might be a slightly weaker urine stream than you used to have, or needing to get up just once more at night than you did a few years ago. It's easy to brush these things off. But these gentle nudges from your body are important signals. Don't let fear, embarrassment, or a wait-and-see attitude prevent you from seeking medical advice. Your doctor is there to help, and an open conversation is the first step to peace of mind and optimal health management. Your prostate health matters, so there you have it, a comprehensive look at understanding and protecting your prostate health. It's a topic that, as we've discussed, is often overlooked or put on the back burner until problems become too significant to ignore. But I hope today's discussion has shown you that knowledge truly is power. By paying close attention to your body and any emerging symptoms, by making smart, informed choices about your diet and lifestyle, and by committing to regular checkups and conversations with your doctor, you can take a proactive stance in managing your prostate health. This isn't just about preventing disease, it's about promoting overall wellness and ensuring you can live your life to the fullest, with vitality and comfort, for many years to come. If this video has provided you with valuable information, or if you know someone, a friend, a father, a brother, a partner, who could benefit from hearing this message, please consider sharing it. Your health journey is important, and supporting each other in making informed decisions is key. And as always, if you found this video helpful, please give it a thumbs up. It really helps the channel reach more people who need this information. Don't forget to hit that subscribe button and turn on notifications so you don't miss out on future health discussions. Because ultimately, men's health matters, and taking these proactive steps is an investment in yourself. Thanks for watching, stay healthy, and I'll see you in the next video.